The main principles of treatment. During the acute phase, unloading the foot is indicated. This can be achieved by various methods. First, the right footwear is selected. In this case, wearing shoes with a completely flat sole or with very high heels is contraindicated. The optimal heel is stable and measures 2-4 cm. The sole should not be hard. In addition, orthopedic insoles and heel pads are used. During acute pain, medications are usually prescribed that are generally known as non-steroidal anti-inflammatory drugs. These include diclofenac, Movalis, and Zifocam. These medications are prescribed for a short course, and unfortunately they all have a very unpleasant side effect. The side effect is on the gastrointestinal tract, which manifests as stomach pain and intestinal bleeding. In addition, various courses of physiotherapy procedures are prescribed. These include ultrasound, UHF therapy, paraffin applications, and low-dose X-ray therapy. If all of this does not help, local treatment is prescribed. A hormone injection, usually Depas or Diprospan with an anesthetic. This is very effective. For heel spur conditions, shock wave therapy is used. Therapeutic. The therapeutic effect of shock waves is based on the fact that the focused shock wave targets the affected area without impacting the surrounding soft tissues, providing anti-inflammatory and healing effects and improving microcirculation. And subsequently, this leads to the growth of new healthy tissue in that area, meaning self-regulation processes are activated. It is not recommended to treat a heel spur at home. For this, it is always better to consult a specialist and receive specific advice. It will always be different, even if it is the same disease. Depending on the stage of the illness, the doctor will give you specific recommendations for each individual patient. So I also do not recommend self-treating based on information from the internet. There are various harmless methods, such as applying a cabbage leaf, horseradish leaf, or potato compresses, which, even if they cannot cure the condition, generally will not do any harm. But there are also recommendations like placing your heels on hot bricks or using compresses with acetic acid essence. In other words, if you follow these recommendations, you can end up with very deep burns and serious problems. In addition, pain in the heel area can be caused by other conditions. It could be Achilles bursitis, or it could be a manifestation of another issue. It could be gout, spinal diseases, or trigger points in the muscles of the lower leg. And only a doctor can determine the correct diagnosis and what treatment strategy should be used in each specific case. Therefore, I recommend seeking treatment after consulting a doctor. A general recommendation. During the acute phase of a heel spur, when the pain is most severe, you should avoid putting weight on it. That is, relieve the pressure using various orthopedic insoles, heel pads, or taping. In the evening, take hygienic warm foot baths. You can add sea salt. Hot water should not be used during the acute phase. And most importantly, follow the recommendations your doctor gave you regarding medication. To improve the elasticity and strength of the plantar aponeurosis, it is recommended to stretch it. To do this, you need to roll your foot from heel to toe several times a day. To increase the effectiveness of this exercise across the sole, it is recommended to use an object such as a rolling pin or a tennis ball.